I'm Mrs. Princey, Associate Professor in Mental Health Nursing. So today I'm going to describe about the nursing management of client with the eating disorders. So you have already learned in the previous videos what are the eating disorders. I've told you about the two conditions, which are the anorexia nervosa and the bulimia nervosa. So what happens in the nursing management? So based on the condition of the client, whether it is anorexia nervosa or bulimia nervosa, nursing management differs, right? So before going to the nursing diagnosis and assessment, let us see the differences between these two conditions. What is the anorexia nervosa and the bulimia nervosa? In case of anorexia nervosa, there is a lack of appetite, or we can say the lack in the interest towards the diet or towards eating. In case of bulimia nervosa, there is episodes of the binge eating, that is, the person does the eating of a particular meal or food within a short span of time. And also, because of binge eating, it does a compensatory mechanism, that is, the overuse of laxatives that he can do, or using the diet pills or diuretics. In case of anorexia nervosa, there is an aversion, that is, to eating. In case of bulimia nervosa, there is a dysfunctional eating pattern. In case of anorexia nervosa, there is weight loss. In bulimia nervosa, there can be weight loss or weight gain. If you take the weight, in case of anorexia nervosa, the body weight is 20% or more under the ideal body weight. In case of bulimia nervosa, you can notice the behavior of refusal to eat because of the guilt. In case of anorexia nervosa, there is difficulty to eat, that is, person finds it difficult to even ingest the food, right? He will completely refuse the food, whereas in case of bulimia nervosa, there is compulsive eating, that is a repeated thought that he gets of eating, and he even does the action of eating. In case of anorexia nervosa, there is a malnutrition. In case of bulimia nervosa, there is excess or the extra calorie intake which will happen. You can notice in case of both anorexia nervosa and bulimia nervosa, there is a common thing, that is electrolyte disturbances that you can note, or fluid and electrolyte imbalances that you can notice in both the conditions. In case of anorexia nervosa, you can note that there is a disturbance in the elimination, recurrent vomiting after eating the food that can be done. In case of bulimia nervosa, there is a difficulty in swallowing because the vomiting or a compensatory mechanism to such an extent that the person may have a raw throat or difficulty in even swallowing the food. In case of anorexia nervosa, there may be a lack of awareness of the need for food as well as the fluids. They even don't mind what can be the complication of not eating the food. Okay, so that is the lack of awareness of not even eating the food or drinking the fluids. In case of bulimia nervosa, you can notice the other conditions of psychiatric disorders like delusions and other psychotic disorders. So this is a major difference between the anorexia nervosa and bulimia nervosa. Moving on to the nursing management. When it comes to nursing management, the first thing is the nursing assessment. You're going to do a complete history collection. You're going to collect the information from the client as well as the family about the eating pattern, especially related to the foodstuffs or related to the pattern of eating hours, the family dynamics are going to note. What are the coping mechanisms that the client is having at times of stress or situations, that you're going to collect the information. What is the pre-morbid personality of the person, you're going to note. The next part is you're going to do a mental status examination to note what is the status of the mind in terms of the mood, in terms of thought, in terms of the other areas. You're going to do a mental status examination. You're going to do a physical examination to find out what are the changes in the physical aspects of a person. Can be monitoring the vitals, monitoring the weight, monitoring the various system changes that can be noted in terms of the integratory system, in terms of the GI system, in terms of the cardiac system. What are the changes that can be noted? You're going to do a complete physical examination from head to toe. Once the assessment is done, you're going to even find out the signs and symptoms of bulimia nervosa or the anorexia nervosa. Based on the condition, based on the problems of the client, you're going to do the nursing diagnosis, or going to state the problems of the client. So I've got some of the nursing diagnoses that you can state for these conditions. The first nursing diagnosis, a very important nursing diagnosis for the eating disorder, is the imbalanced nutrition, less than body requirement or more than body requirement related to refusal to eat or drink, self-inducing vomiting, use of laxatives or diuretics, intake of nutrients that exceeds the metabolic needs, as evidenced by frequent disturbances in the weight, easy fatigability, meal that is not completed on time, and dry mucous membrane. So these are some of the features that you can note in the imbalanced nutrition less than or more than body requirement. Now, what is the nursing interventions for this diagnosis? Make a therapeutic contract with the client regarding the time, frequency, and the procedure of weighing the patient. So you need to have a contract with the client regarding monitoring of the weight. It is not frequently that he needs to monitor the weight and get anxious about his changes in the weight, but you need to have a fixed schedule for monitoring the weight in terms of the time, in terms of the frequency. As a nurse, you're going to make a complete schedule for the client in terms of the eating pattern. Explain about the meal timings, when the meal will be served, the number of meals that the client is supposed to eat in case of anorexia nervosa or even the bulimia nervosa. Make a schedule about the meal timings. Make a realistic goal that can be attained by the client, say for example 1 kg per week that he can attain. Or if he fails to attain this particular set goals, then tell him that alternative arrangement that has to be made, that is an inpatient treatment, may be required for the client. So that can be the nursing interventions that you can do for an imbalanced nutrition less than body requirement or more than the body requirement. The next nursing diagnosis is anxiety related to weight gain as well as disturbances in the body image. What is a nursing intervention? You need to talk with the client about the importance of modifying the eating pattern. So if you take the eating pattern in case of anorexia nervosa or bulimia nervosa, it's different, right? So make time with the client to make him analyze the importance of modifying his pattern of eating. Encourage the client to have an exercise. It can be any exercises related to relieving the stress and anxiety, like involving himself in the various relaxation techniques, aerobic exercises, use of meditation, yoga, relaxation therapies that you can make the client to indulge in so that he can reduce this anxiety and stress. So instead of having this compensatory mechanism, that is eating behavior for the stress and anxiety, he can use these alternative compensatory mechanism, which is really not only going to help him to improve his health but also reduces his anxiety and stress as well as fear. So this is the intervention for the anxiety. The next nursing diagnosis is the ineffective coping responses related to purging behavior, inappropriate eating pattern. What is the goal that you have to set? The goal here is to maintain the normal eating pattern as well as to cope with the planned eating program. What are the nursing interventions? Encourage the client to make the list of those either situations that forces him to use the maladaptive eating as well as the purging behavior. So those situations, if he could list it down, it will be easier for the client to overcome this maladaptive way of coping. So he can try to avoid such kind of a situation, or even try to use the better coping mechanism in those situations which forces him to indulge himself in this abnormal pattern of eating behavior. Teach the client about not only identifying these risk situations, but also to cope up with those situations by effectively using the coping mechanisms. The next nursing diagnosis is inadequate decision making related to one participating in treatment plan or lack of assertiveness. What is the goal here? The goal here is the client should verbalize his or her feelings directly. What are the nursing interventions? So review with the client what are the decision-making strategies that he has got to modify the particular behavior. Make the client to become aware about what decisions that he can make at the given situations, which is difficult for the client to handle. You teach the client the various assertive mechanisms that he can make to control his behavior. And also you can even conduct the role modeling sessions wherein the client can really witness those so that he can model his behavior, right? So you involve the client in such a kind of sessions which includes the role play, psychodrama, wherein the client will get an insight about how to face a similar kind of a situation in his life. So that is about the ineffective decision making. The next nursing diagnosis we have is a disturbed body image related to confusion in mental picture of one's physical self as evidenced by worry about the weight gain, lack of confidence, as well as the low self-esteem. What is the goal to be set? The goal here is to maintain the normal body weight or the body image and participate in the therapeutic milieu. What are the nursing interventions? As a nurse, you're going to determine whether the client has the problem with the perception, attitude, or the behavior, and then you can plan a program that is related to the specific kind of the problem the client is dealing with. Teach the client about the integration of mind and the body and to use a better coping mechanism to maintain the ideal body weight rather than using these compensatory mechanisms like purging behavior, use of laxatives and abuses. Instead of that, you can teach the client the better coping mechanisms for maintaining the ideal body image, like involving him in the dance or movement therapies, involving himself in the exercise programs that will create a pleasant body experiences for the client. As a nurse, you're going to bring about the change in the negative thoughts of the patient related to the body image. So bring about modifications in the pessimistic way of thinking. You can make use of the guided imagery as well as the relaxation techniques. You can even involve the client to work with the mirrors so that he could depict his own self through even the art therapy, right? So these are the various other therapies that you can involve the client so that he can get a better awareness about the body image and he will be able to have a modification in his thought by involving himself in the various types of the therapies like the behavior therapy, art therapy, music therapy, dance therapy, or the relaxation techniques as well as guided imagery. So by this that he will be able to develop the thought about the body image and he will be able to develop such a kind of a confidence about his body. The next nursing diagnosis is a low self-esteem related to negative self-evaluation as evidenced by poor interpersonal relationship and not expressing his feelings. The goal here is to express his or her feelings or ideas effectively as well as confidently. What are the interventions? As a nurse, you're going to reinforce the social alliances, the social associations the client can have. He may feel very guilty or he may feel very, poor in his confidence to face the social situations or social groups. So, as a nurse, you're going to reinforce the client to encourage him to involve in the group therapy sessions, to involve himself in the social groups, encourage him to express his ideas or feelings, and also you can involve the family members in the treatment of the client so they will be able to give the support to the client in terms of overcoming this negative behavior. So the empathetic support is very much essential so that his esteem can be boosted up and he will overcome this low self-esteem. So these are the various nursing diagnosis and interventions that you can plan for a client who is suffering with the eating disorders. So this is all about the nursing management. Hope you all have understood the topic. Thank you.